Speaking during a Joy News Thought Leadership event held in our studios yesterday, Presidential Advisor on Health Dr. NHIA revealed that National Health Insurance has set up a committee to review and assess whether the NHIS can absorb the cost of dialysis. This was corroborated by the Director of Corporate Affairs at the NHIA, Oswald Mensah, at the same event that brought together all stakeholders. Dr. NHIA also revealed the process to make kidney transplant available in Ghana is underway, with a document being reviewed for a law to harvest, store and donate organs. Maxwell Agbagba has more in the following report.
I'm very angry.
What's your story?
I am very angry. I'm more angrier this morning. People are dying each day. The dialysis machine in Kolebu Gospel.
Voice of activist Nasiba Bauer at a protest demanding a reduction in the cost of dialysis treatment after the Kolebu Teaching Hospital increased the cost from 380 cedis to 765 Ghana cedis. The amount has since been reversed. It triggered the Dialysis Crisis series on Joy News, highlighting the plight of 54-year-old Georgina Pia, who couldn't afford the cost of dialysis. 15-year-old Priscilla Sante, who died some hours after she was featured in the series, pleading for assistance with her dialysis treatment. Some patients with kidney failure held a press conference and said 14 of their members have died between May and September after the Kolebu Teaching Hospital limited its dialysis treatment to just emergency cases. The hospital said it had run out of consumables. The renal patients who said they were being sponsored were now compelled to pay for dialysis treatment in other facilities. Speaking during the stakeholders event held in the studios of Joy, Chief Executive Officer of the Kolebu Teaching Hospital, Dr. Pokuwari Ampoma, said the decision was taken because the Kolebu Teaching Hospital renal unit is suffocating under a 4 million Ghana cedis debt. He's unsure when the services will be made available to outpatients. He says the facility will also need 961,000 Ghana cedis monthly to keep the cost of dialysis at 380 Ghana cedis.
We are now engaged with government, with the ministry, with other stakeholders to see how quickly we can, find the resources to advance. Because at the moment we are sitting in a 4 million cedi hole. If we are to operate at our current capacity, which is about 2,000 dialysis sessions every month, then it means that we are going to accumulate about 961,000 cedis of debt every month, in addition to the 4 million cedis that we have already. So this is financially unsustainable.
You can't tell when exactly the OPD will be opened.
Yes, exactly.
You can't tell.
I can. Yes.
Okay.
So it's 4 million. We have a 4 million deficit.
Deficit. Okay.
And then if we are to run at full capacity,
okay,
we will need about 961,000 cedis subsidy every month to be able to maintain the current prices.
Presidential Advisor on Health, Dr. NHIA, says steps have been taken to settle the debt.
We are waiting for what they are supposed to bring and then to be worked on as quickly as possible. The money is supposed to be provided by our Ministry of Finance, isn't it?
Yes. Yes. Okay.
So Dr. Mpoma has to put everything that he's doing, that is being asked to do, as quickly as possible in place. If I were him, I would use 24 hours to put everything in place and present it.
We can now listen to a pharmacist and CDD fellow in health who also participated in that conversation.
A lot of us thinking that the previous government had been symbolic, and I make no apologies for my views then. The first thing they did was to pass a law to say statutory payments could be capped, and they could then decide what they were going to use it for. What they didn't realize, and that is why I always go by data, they didn't look at our 10-year disease trends to realize that our disease burden as a country was doubling. And we were moving from a situation where predominantly infectious diseases were the mainstay of our disease burden to a state where chronic diseases are the mainstay of our disease burden. So, for example, currently, if you look at 2022 data, malaria is still the leading cause of mortality. but its contribution to our mortality has dropped by 46.6%, whereas strokes have gone up by almost 10%. So if you go capping the funds, when the diseases that are causing people to die are more expensive to manage, you cannot convince me that the NHIS, and that's why you've seen on my social media handles, I've asked the question. Those people telling me and Ghanaians that the NHIS should take on and fund dialysis, where are they going to get the money from? The truth of the matter, and that was why some of us raised hell when this whole capping law was going in. The truth of the matter of a health insurance scheme is that you expect them to have an excess of inflows so they can invest it. So when they are recalled to pay for some of these more expensive procedures like chronic diseases, dialysis, prostate cancer, breast cancer, they can get money out of the investments they have made with the premiums they have received to pay for them. But this government, in its wisdom, telling us we have the men, took the money and said they can prioritize where the money should go. So I'm now listening to someone from the NHIS telling me that we are not liquid. And I'm saying, now who costs up? How can you be liquid when you never invested the monies that were coming to you for 6.5 years? You can't be. And that's why, though we are having a serious conversation, I am laughing. Because I'm like, we shot ourselves in the foot, and now we're bleeding, and we're saying, how come the gun hurt?